How many times a day do you come in contact with people that you don't know their sexual orientation, their medical history, or really anything about them? I would say quite a bit. You go to a restaurant and eat, you're in contact with the waiter or waitress, the person preparing your food, and maybe others in the restaurant. You go to the grocery store and buy groceries. You're surrounded by other shoppers. You make contact with the cashier as she takes your money or checks you out, and the person who bags and takes out your groceries. Most likely, you know nothing about these people. Discrimination, as defined in the Webster's Dictionary, is the unjust or prejudiced treatment of a different category of people or things, most of the time pertaining to sex, race, or age. HIV or AIDS has a huge stigma in America. Over 1.1 million people are infected, according to the CDC. Most stigmas come from people who are uneducated and unaware of how it's spread. There are only 5 ways that HIV and AIDS could be spread, and that is through semen, blood, vaginal secretions, rectal secretions, or breast milk. So in other words, unless you're using the same needle as someone, breastfeeding someone, or having sexual contact, you most likely are not going to get HIV from somebody. You can't get it from saliva, so that means you can kiss somebody. You can't get it from hugging someone. You cannot get it from shaking hands with someone. Although most people think that saliva transmits the HIV/AIDS virus, it does not. Only those 5 things I mentioned before do. Federal law prohibits discrimination of anyone with HIV or AIDS, especially from federally funded sources such as hospitals, clinics, social services, nursing homes, drug treatment centers. Although we think of healthcare workers as being non-judgmental, that is not true. We face everyday healthcare workers discriminate. People infected with HIV and AIDS especially. People don't want to treat them because they're afraid they're going to get it, or, there are universal precautions to use to, even if you're working with this person's bodily fluid. So, like I said, uneducation is about the spread of this virus is the reason that there is such a stigma towards HIV and AIDS. But there is a law, HIPAA. It's the Health Insurance Portability Act of 1996. It prohibits healthcare workers or anybody with information on someone's health to only share it with people that are directly in the care of those people. So again, it's against the law. A 2009 national survey done by AMA Journal of Ethics showed that 42% of people would be uncomfortable being a roommate of someone with HIV. 23% would be uncomfortable with having a coworker that is infected. And 35% would be uncomfortable with their child being taught by a teacher who is infected. 71% of these people were wrong about the transmission of HIV. They were thinking that you could touch them or sneeze on them, which is untrue. Think about it. Every day you come into contact with people who you have no idea what their medical conditions are. With 1.1 million people being infected, chances are you have come in contact with somebody who is HIV or AIDS infected. So, but like I said, transmission is only through those bodily fluids. So if we could educate the public, especially healthcare, on how this disease is spread, then we can help stop the discrimination of these people. Most of the stigma and discrimination is fueled by myths of transmission biased against groups such as homosexuals or drug users. A lot of the stigma is that because someone's a homosexual, they are more likely to have HIV, which is not true. But discrimination is a major factor, and it's something that we have to educate the public on so that this can stop for these people. Some children are born with HIV, and they will have to live with this discrimination all their life, as far as from healthcare, family, school, public. It doesn't matter. They will, discrimination is there. So I believe if we would educate on the spread of HIV, we could help this discrimination stop. We could also help maybe stop the transmission of it, because like I said, there are only 5 ways it's transmitted, and that is through blood, breast milk, semen, bodily fluids such as vaginal and rectal. So therefore, you have a normal interaction as we do every day with someone, you do not have the chance of being HIV infected, only if you come in contact with those 5 fluids. So I hope with education that we can stop the discrimination against people with this disease. They can live normal, healthy lives as you and I.